Good afternoon, everyone. Thank you for joining us again today for this briefing. I want to start today, as indeed I always do, by updating you on some of the key statistics in relation to COVID-19 in Scotland. I can report that as at 9 o'clock this morning, there have now been 10,721 positive cases confirmed. That's an increase of 200 from yesterday. A total of 1,754 patients are in hospital with confirmed or suspected COVID-19. That is a decrease of 8 from yesterday. A total of 126 people last night were in intensive care with confirmed or suspected cases of the virus, and that is also a decrease of 8 since the figures I reported to you yesterday. These figures do, as I've said over the last few days, continue to give us cause for cautious optimism. I'm also able to confirm today the positive news that since the 5th of March, a total of 2,448 patients who had tested positive for the virus have now been able to leave hospital having recovered from it, and we all, I'm sure, wish all of them well. On a much sadder note, I have to report that in the last 24 hours, 70 deaths have been registered of patients who had been confirmed through a test as having COVID-19. That takes the total number of deaths in Scotland under that measurement to 1,332. Tomorrow, of course, we will see the publication of the National Records of Scotland weekly statistics that cover not just people who died having had a positive test, but also those where COVID-19 is a presumed factor in the deaths. Now, these numbers, as I stress every day, are not and never will be seen as just statistics. Behind each and every one of these numbers is a unique and irreplaceable individual whose loss is a source of grief to their friends and family. So once again, I want to send my thoughts and my deepest condolences to everyone who has lost a loved one to this virus. I also want to thank, again, as I always do, and consider it important that we always do, our health and care workers. Everyone across Scotland continues to be grateful to you for the extraordinary work that you're doing. Many of us will have joined the minute silence at 11 a.m. today to honour the frontline workers, including, of course, health and care workers who sadly lost their lives while working to tackle this pandemic. It was a reminder of the selflessness of our health and care workers choosing to treat and care for others during a time of crisis. And it was also a reminder of the government's duty to do everything we can to keep these workers safe. I have two issues that I want to update you on today. The first relates to testing. We have been making steady progress on increasing our testing capacity over the past month from an initial starting capacity that could cope with 350 tests a day to a capacity of at least 3,500 tests a day by the end of this month. And we will give a further update on testing capacity at the end of this week, which of course is also the end of this month. But as a result of the work we've been doing so far to build capacity, we've already been able to expand testing in some priority areas. Tests are currently made available and processed within NHS labs for people in hospital with symptoms of COVID-19 and all patients in intensive care, for people who've been referred for testing by their local COVID hubs, people in care homes who have symptoms and people who are being admitted to care homes, and key workers in our health and care services, and where appropriate, their family members. And in that last category, I can report that more than 20,000 people have now been tested. In addition, of course, key workers in other sectors, for example, the prison service, are able to book tests online for the drive-through centres that have been established at different locations around the country. And today we are confirming a further expansion of testing. All NHS boards are now being asked to put in place procedures to test all those over 70 years of age who are admitted to hospital for any reason, not just those with COVID symptoms. As we know, the virus can have an especially severe impact on older people, And so although we don't usually test people without symptoms because the test isn't totally reliable in those cases, we do think that there could be a benefit in testing older people, both on their admission to hospital and then at intervals thereafter. So patients in this category will be tested on admission to hospital and then every 4 days throughout their stay in hospital. And that will help us identify if the virus is being transmitted within a hospital, and if so, how and where. And it will also help us provide better care for other older people in hospital and therefore contribute to our wider efforts to slow down the spread of the virus. The second issue I want to address today is relevant to everybody watching at home, and it relates to face coverings, an issue which has attracted lots of attention recently. Guidance on this issue has just been published on the Scottish Government's website, and I want to tell you today what that guidance says. Before I do, though, I want to stress at the outset a very important point and ask you to bear this in mind. I'm talking here about face coverings made of cloth or other textiles, such as a scarf. I'm not talking about medical grade face masks that you would see health and social care workers wearing. The guidance that we are publishing today firstly makes clear that the most important step we can all take to prevent transmission of the virus is to comply with the current stay-at-home, social distancing and hygiene rules. Face coverings are not, I repeat, not a substitute for any of that. The guidance also makes clear that the evidence on the use of face coverings is still limited. However, it recognises that there may be some benefit in wearing a face covering if you leave the house and enter an enclosed space where you will come into contact with multiple people and safe social distancing is difficult. For example, on public transport or in shops. Of course, just now, most shops are closed, so right now this would apply in particular to food shops. Now, to be clear, the benefit comes mainly in cases where someone might have the virus but isn't aware of that because they're not experiencing any symptoms and therefore not isolating completely in line with the rules. So wearing a face covering in these circumstances may reduce the chance of that person transmitting the virus onto others. So the Scottish Government is now recommending the use of face coverings in these limited circumstances as a precautionary measure. Given that the evidence is relatively weak, we're not at this stage making this mandatory or suggesting that it will be enforced, though we will be keeping that under review as we go into future phases of managing and tackling the pandemic. And of course, it's worth bearing in mind that there are some people, for example, people with asthma, who might have very good reasons for choosing not to cover their mouth and nose when they're out and about. And we're not recommending the use of face coverings for children under the age of 2. However, to repeat, we are recommending that you do wear a cloth face covering if you are in an enclosed space with others where social distancing is difficult, for example, on public transport or in a shop. But let me emphasise the key point here, which is that you should not really be in situations very often like that right now if you are complying with the stay-at-home rules. Now, the guidance states that there's no evidence at this stage to suggest that there are benefits to wearing a face covering outside, except in unavoidably crowded situations. But again, we are keeping that aspect under review. The guidance also includes some information on how to safely apply and wash face coverings. When you're applying or removing the face covering, you should first wash your hands and avoid touching your face. And after each time you wear the covering, you must wash it at 60 degrees centigrade or dispose of it safely. The detailed guidance, as I've said, is available on the Scottish Government's website, and the guidance on the NHS Inform website will also be updated very soon. But the most important point I want to stress again is this one. The wearing of facial coverings is an extra precaution that you can, and we are suggesting you should take. It may do some good in some limited circumstances, but it is not, and it must not be seen as, a substitute for the other rules and guidelines that we have been stressing and asking you to comply with. In particular, anyone with symptoms of COVID-19 and all members of their household, regardless of whether or not they have symptoms, must self-isolate. Guidance on that is already available on the NHS Inform website. And physical distancing, hand washing and respiratory hygiene, covering up coughs with disposable hankies or even with your sleeve, remain the most important and effective measures we can all adopt to prevent the spread of the virus. So please, above all else, continue to follow the rules that we have set out. Stay at home, except for essential purposes such as buying food or medicine or exercising. If you do leave the house, you should stay 2 metres apart from other people, and you should not meet up with people from other households. And of course, you should wash your hands regularly and thoroughly. I know, as I say every day, but every day it becomes ever more true that sticking to these rules is really, really difficult, but it remains essential. It is how all of us can help to continue to slow down the spread of the virus, continue to protect our NHS from being overwhelmed and continue to save lives. So thank you for sticking with it, and please continue to do so. I'm now going to hand over briefly to Professor Jason Leitch, our National Clinical Director, before handing over to the Chief Nursing Officer to say a few words, and then of course, as usual, we'll take questions. Jason.
Thank you, First Minister. Let me first of all say that Scotland is doing an excellent job, and you have to stick with it. As the First Minister said, we're beginning to see early signs of what your behaviours are doing, so please continue to do that. I wanted to take a moment, though, today to acknowledge the work of another relatively unsung part of our health and social care workforce. The approximately 11,000 social workers across Scotland are working 24/7 extremely hard to protect vulnerable children and adults in every one of our communities. Their work is particularly vital at this time because those that they serve, like the rest of us, are confined in a way that means seeking help and assistance is that much more difficult than usual. Social workers work for local authorities and in the voluntary sector. They use human relationships to address the trauma, the disadvantage and inequality which marks all of our communities. They work in prisons, in hospitals, in every village, town and city of our country. They protect us. They promote independent living, quality of life for those they support, and they take difficult decisions every day on our behalf. Like other elements of our service, in social work, those that have left the profession have responded to our call for extra support because of the pandemic. We have almost 200 retirees and 90 returners from national agencies who have volunteered to rejoin the front line. I want to pay particular thanks to them. It demonstrates their and the social work profession's vocation and selfless commitment to others. Like so many others, the social workers of our nation have stepped up to assist our response. I and the Chief Social Work Officer for Scotland, Iona Colvin, are very, very grateful. First Minister.
Thank you, Jason. And I'll hand over now to Fiona McQueen, the Chief Nursing Officer.
Thank you, First Minister. And building on Jason's point about people who are there to help our community and our society, I want to say something in particular to the children and young people of Scotland and also to their parents and carers. I recognise for some children and young people this is a wonderful time for them, and for other families it can also be a worrying time. And making sure children and young people are healthy, both physically and have good mental health, has probably never been as more important as it is just now with the restrictions that are being placed on all of us in society. So making sure that children and young people eat healthily, for that once a day when you go out to exercise, taking real advantage of that as a family and socially distancing. But also when children and young people are in the house, there are great opportunities to make sure that they are keeping active and keeping healthy and well. Some children and young people may already have ongoing chronic physical health conditions or mental health problems. And the practitioners who care for these children and young people are still there. They may be available in a slightly different format, whether it's through Near Me and looking at remote ways of consultation, but they're there and waiting and ready to support whenever there is a problem. Because of what people have been doing, our NHS has not been overwhelmed. Our NHS is open for business. It is safe, whether it's within our GP and primary care surgeries, or within our hospitals, or within our accident emergency departments. We have excellent infection prevention and control measures in place, and all of our institutions are safe for you to visit if you are worried about any aspect of health of a child or young person in particular. NHS Inform would be a first source in terms of looking at both physical and mental health problems. If your GP surgery, again, is open for business in a different way, 111 and of course A&E. For parents of young children who perhaps use health visiting services, again, our health visitors and of course our midwives for newly born babies are also available, able to do home visits if needed, but ideally through a remote consultation. So if you're worried in any way at all about any aspect of health and well-being of a child and young person, whether it's mental health or physical health, do not hesitate to contact your routine way that you would use contact into our NHS or 111 NHS Inform or our A&E department. And similarly for the routine public health promotion materials such as vaccination, again, still open for business. It's incredibly important that people remember that, know that, and access our services wherever they might be, for whatever that might be, to keep our children and young people and our families healthy and well. Thank you.
Thank you very much, Fiona. We'll move on now to questions as usual. The first question is from Ivana Holland from STV.
Thank you, First Minister. Do we have, in regards to testing, figures about the uptake that we're seeing? If you say you want a capacity of 3,500 by the end of the month, do we know how many people are actually using those tests, whether they're NHS frontline staff or regular members of the public? Do we have those kind of figures? And then in regards to face coverings, that seems quite a simple recommendation. We saw in places like Italy, where many people were walking around with masks. Is that maybe a recommendation that could have been made earlier, if a simple scarf could help prevent the spread of the disease around shops?
Okay, on testing, we publish the daily figures of positive cases and negative cases, so we see that numbers of tests fluctuate on a daily basis, but we are working to increase that progressively so that the tests done meet the capacity. We set a target of 3,500 in terms of capacity by the end of this month. We are on track to meet that. I think we will exceed that. But of course, there's no point having capacity if you're not using that capacity. So when we get to the end of the week, the end of the month, we'll set out where we are in capacity, but also where we are in terms of the usage of that capacity. The final point to make on that is that both of these figures will continue to develop in the weeks to come, because as we go through the next number of weeks, I don't know yet exactly how many weeks this will be, and move into a phase where we are slightly easing perhaps some of the restrictions that are in place, the importance, not as the complete solution, but as part of an overall approach of a test, trace and isolate strategy becomes more important. And clearly we need to build up testing capacity to be able to do that, as well as doing more testing perhaps in different categories, well certainly in different categories to do that. So what we will set out at the end of this month, the end of this week, will be where we are now, but nobody should assume that that is the end of the line on testing. There is a different phase that we're already working to move into. On the issue of face masks, as we know more about this virus, evidence and advice on a whole range of aspects of it is changing. So we've been keen to get the evidence and the advice as far as we can in order to issue this guidance that we've issued today. And there's really two related reasons why I think it's important that we're doing this now. Firstly is because the evidence now, and as I said earlier on, it is limited. It's not the most overwhelming evidence I've ever seen, but there is some evidence now that in the kind of limited circumstances I've set out, there can be some benefit. And in short, again, that is a benefit in the form of somebody with the virus, but perhaps not knowing it, being at reduced risk of transmitting it to somebody else. And I think if we think there is some benefit, it's important that we set that out. But the second reason is that anecdotally, it seems to me more and more people are choosing to wear these kind of cloth face coverings if they're going to the supermarket for shopping, for example. And the other reason I wanted to make sure we put some guidance out is to put that in the context of, yes, the benefit we think there might be, but also to stress the limitations of that. Because what I don't want are people thinking they are invincible to this virus because they're wearing a face covering. And I want to stress the point I've made already today. is that this, in these kinds of circumstances, is an added precaution you can take. It is absolutely not a substitute for the other things we're asking you to do. And you shouldn't think it gives you license to do things that the rules say you shouldn't be doing. In circumstances that you're permitted to be out right now, to go for food shopping, for example, it will give you an added bit of protection. And I wanted to make sure that as well as setting out that there was some benefit, we were also setting out what the limits of that benefit were, so that people don't think it's conferring protection above and beyond what it actually is. Can I move now to Lisa Summers from BBC Scotland?
On facial protection, you've gone for a fairly cautious approach, unlike countries such as Germany who've made it mandatory. Can you explain a little bit more about who you would hope or expect to wear these face masks? Would it be people that are having to go to work in factories, for example, as well as those who are popping out for shopping? And can I also get some clarity, given that we've had a minute's silence today to honour those who have died on the frontline services? Can you tell us yet or explain why we've not had numbers for Scotland of healthcare workers who've died, given we've had some very moving tributes for some of them?
I want to come on to that point directly. I think I gave some of the rationale for this last week, but I think it's important I do so again. On the face coverings point, though, let me say, as is the case with so many aspects of how we deal with this virus, this guidance may well evolve and develop. We're not making it mandatory right now because, as I said, the evidence is not overwhelming about this. But given that the evidence says there might be some benefit, I think it's important we say that to people. The circumstances in which we are suggesting, recommending that people use these kinds of face coverings would be if you are in an enclosed space with other people and it's not easy always to keep the 2 metres distance. Now, the examples I've given are public transport and shopping, but of course that is not exhaustive. The enclosed space with other people where you may feel you're coming into closer contact than is comfortable. But I would stress again that under the current rules, you shouldn't be in those kind of circumstances very often. It should be very limited occasions in which you find yourselves in these circumstances. But when you do, this is an added precaution. It is not a substitute for avoiding those kind of circumstances in the first place. Now, we're not making it mandatory right now, but as we go into a phase of perhaps starting to lift some of the restrictions and people are perhaps coming into contact with others a bit more than they are right now, we will review that. And it may be that at future stages, we take a tougher stance on that. But it's important we don't get too far ahead of where we are right now or too far ahead of the evidence. And I don't want people putting so much store and emphasis on facial coverings that you forget the most important things that you should be doing. Staying at home unless it's essential, not mixing with people outside your own household, staying 2 metres apart from other people when you are out, and making sure that you're following all the hygiene rules. On the issue of people who die in health or social care settings as a result of this virus, people who work, in health and social care settings as a result of this virus, it is really important to the public, but I can tell you it's really important to me personally that we do gather this information in a robust and reliable way. And we are putting in place, or have been putting in place, processes to make sure we do that, so that we're not relying on anecdotal information and not inadvertently perhaps underestimating. So we are firstly doing that. Amongst other things, it is important, I think, that we do take the opportunities with the consent of families to pay tribute to people who die in these circumstances. So we need to have that information gathered robustly. But, and before I say this next bit, please, every single person who dies in these circumstances is a tragedy. So I'm not trying to minimise the scale at all. But in Scotland, both in terms of health and social care, we are still talking about relatively small numbers. And as you will have heard us say before in other contexts, when we're reporting these statistics, there is a threshold below which we don't publish numbers for fear of identification of individuals when perhaps their families wouldn't want them to be identified. So that's why we're not yet publishing numbers, but when we are in a different position to that, we will be publishing numbers, and we will have put in place the processes to make sure that those numbers are robust and reliable, as I think everybody would expect and want us to do. James Matthews from Sky.
Thanks very much, First Minister. What is the advice that has changed your mind on face coverings in the past few days, and where did it come from? Also, you have a UK audience at these news briefings. What do you say to people outside Scotland watching this, listening to you, thinking, why has my government not told me that face coverings are a good idea, and what should I do?
Well, the advice that has come to me now is, as I've set out, that there may be some benefit in limited circumstances. The evidence is not overwhelming, but I've set out why, on balance, for that reason, but also because I didn't want people going around thinking that actually there was more benefit than there actually is to wearing these face coverings. I know Sage has looked at this issue, and I've obviously had advice from the Chief Medical Officer in the Scottish context, which has led to the guidance we're publishing today. I think all governments across the UK are considering this, and it's not for me to speak for any of them, and I'm not going to try to. Equally, it's not for me to give advice to people in other parts of the UK. My judgment is that this guidance is appropriate in Scotland. I'd said previously I had a lot of sympathy with the comments that Sadiq Khan has made from the London perspective. So, you know, as I've said before, there will be some instances where we decide to do things perhaps ahead of elsewhere, and vice versa. There may be some of the other administrations that decide to do things ahead of Scotland. That should not indicate a difference of opinion or a divide or a split. My responsibility is to make judgments based on the best evidence I can get about what is right to protect the people of Scotland, and that's what I'm seeking to do with this guidance today. Kieran Jenkins from Channel 4 News.
First Minister, the Care Inspectorate records the number of suspected coronavirus deaths in care homes, irrespective of what appears on death certificates. So they know about deaths that may not have appeared in the official count so far. Now, they tell us the Scottish Government has this data. So why are these figures not being published in Scotland?
The way we're publishing, and let me say that this is the best and most reliable way to publish these figures is, so we'll get the latest version of this tomorrow, where National Records of Scotland look at death certificates and publish the totality of people who have died in a way that is related to this virus. So that includes those with a positive test result, but also those where it is mentioned on the death certificate. And that, as you know, is broken down into location, care home, hospital, people at home or other institutions. But what that publication also reports on is excess deaths. So we've had this discussion in the last couple of weeks where there has been a number of deaths that are not that are above the average for the same week in previous years, but are not attributable to COVID. So the totality of deaths in any week is published very transparently in that publication, and we will continue obviously to do everything we can to ensure that there is accuracy around the numbers of deaths that are related to the virus. And I think I can't speak for the statistics that are published elsewhere, but I am confident that we are publishing here statistics that are accurate about the people who die in a way that is related to the virus, but also the overall number of deaths. So if there's any discrepancy between the two, people can see that transparently. In the last 2 weeks, we have spoken about the need to further understand that portion of excess deaths that are not being attributed to COVID, and there was some explanation of that in last week's publication, and we'll see later on, or we'll see tomorrow, whether NRS are able to give any more explanation at that stage. Sarah Smith from BBC News.
Thank you. You've made clear that wearing face coverings is more about protecting others than defending yourself. Would you go so far as to say it's our duty to do that if we're in crowded spaces, the same way you consider it's our duty to stay home as much as possible?
I think everybody wants to do everything they can to protect others right now. That's why compliance with all these measures is so high. So yes, I'm recommending that you do consider, as part of the obligation we all have to protect each other, to do that in the circumstances that I've set out. I do want to say, though, there will be very good reasons why some people don't think it's appropriate. I've cited today people with asthma, where covering your nose and mouth may not be an appropriate thing to do. So what I don't want people to do is be pointing the finger at people who are not doing it because there may be good reasons for that. But I believe right now that all of us want to do everything we can to protect each other from this virus, and this is an additional way that we can do that. But as I say again, and I will keep saying this, it is not a substitute for all the other things we do. The best way you can protect yourself and others is to stay at home unless it's essential and to follow all of the other rules that are in place. This is something that gives you a bit of added, or allows you to give others a bit of added protection, which is why we're recommending it. Tim Batchell from ITV Border.
Thank you, First Minister. With today's statistics, once care home deaths and community deaths are taken into account, I believe that we now have more than 2,000 deaths in Scotland. At this morning's Health Committee meeting, we heard some damning evidence from Professor Sir Hugh Pennington saying we didn't test soon enough, we didn't have enough PPE, and we haven't done enough to protect vulnerable residents in care homes. With that and that shocking death toll, will you now admit that your government made the wrong choices on testing and lockdown at the start of the pandemic?
No, I don't think that would be a reasonable thing to do. That said, all of us will do everything we can to learn as we go, and we will get to a point where all of us want to look back and look critically, if appropriate, at the things we did and didn't do. And I don't mean this as a criticism of anybody, so don't take it that way, but the easiest thing in the world is, with the benefit of hindsight, to look back and say you should have done things differently. We're all dealing with certainly in our experience, an unprecedented situation. We are still learning more about this virus almost every day that passes. There's still an awful lot we don't know about it. So we have taken the best decisions at every juncture. Will we have made mistakes? Undoubtedly. I don't think there will be a government anywhere in the world that will not be in that position. But we've taken the decisions we thought were right and best, informed by the best evidence at every stage of the way. And it's really important. We are, and no country is anywhere near through this pandemic yet. So for any country to be, saying we've cracked it, we've succeeded, we've been victorious over this virus is premature. And in many respects, important though the decisions that lie behind us have been, there are really big, important decisions that still lie ahead of us. And as First Minister, it's really important I stay focused on making them, to the best of my ability, guided and informed along the way by the best advice. And that is what I will do. In terms of the preface to your question, in terms of numbers of deaths, of course, we will see the up-to-date figure in the NRS publication, which is published tomorrow. So I wouldn't want to speculate on figures before any of us have seen that information. Andrew Baxter from Global Radio.
First Minister, with schools and nurseries closed, some children are having to spend this lockdown in really tough conditions at home. What are you doing to try and help and support vulnerable people across Scotland?
There's a whole range of steps we're taking to try to help people generally, but also people who are living in vulnerable situations. And of course, there are different illustrations and examples of vulnerability. Schools, teachers, local authorities are working hard to support children during this period with learning at home, but also making sure that there are steps being taken to protect more vulnerable children, making sure, as one example of many things we'll be doing, making sure that children who are eligible for free school meals still get that eligibility in some way, shape or form. We're also working to make sure that we've got the mental health support increasing for people who need it, that we have given additional funding to organisations that provide support for those who are affected by domestic abuse and violence. And we've made a lot of additional money available to local authorities to do things like increase the capacity of the welfare fund, make sure there's funding going to efforts to deal with food poverty. So in a whole range of different ways, we are trying to recognise that, we say often we're all in this together, and in one sense we are, but depending on our circumstances and different features of vulnerability, we'll all be experiencing this crisis differently. And it's really important in the government's response that we don't lose sight of that, and we're trying very hard not to. Jack Foster from Central FM.
Good afternoon, First Minister. Actually from Global Radio, not Central FM, but Not at all. Just also on those comments from Professor Hugh Pennington this morning on the spread of infection in care homes, which Tim referred to just a moment ago. Specifically, I'd like to ask about what he referred to as the need for routine testing of anyone who's either living or working in these spaces, where potentially up to 40% of people could be spreading the virus with no symptoms. What's your reaction to that evidence, and how seriously are you looking now at routine testing for care home residents and staff?
Can I preface this by saying I've not seen the evidence that Hugh Pennington gave at the committee this morning, so in a sense I'm answering this just based on what you've told me in the question. I've not had the opportunity to actually look at it. So one of the things, and I'll maybe hand over to colleagues here to say a bit more about this, one of the things that is still developing knowledge around this virus is the degree to which you can spread it without having symptoms. And that's something that we're paying very close attention to. So, I've announced today an extension of testing in terms of the over 70 population being admitted to hospital, whether or not they have COVID symptoms. And we are looking at that in other settings as well. And as we continue to ramp up our testing capacity, we will look at where the clinical case can be made for extending that. Let me stress, though, right now we have an approach in place that would test any symptomatic patient in a care home and also anybody being admitted to a care home. But we continue to keep these issues under very close review. Fiona, do you want to say a word or two more?
Yes, thanks, First Minister. And as the evidence is emerging, what we do know is that for older people in particular, the presentation of COVID may not be the typical presentation. And that's why, in addition to looking at testing all overtly positive patients, we've given advice to care homes about being careful and being attentive to those who perhaps are not quite themselves, so that they too would be tested. We do have an expert clinical group, as well as working with our care home colleagues to make sure that the guidance that we have is appropriate, is safe, and that will come out and will change. We've already issued guidance, we'll be issuing more guidance, and that will continue. And the testing of residents as well as staff who are not symptomatic will absolutely be part of that, because as the evidence is emerging internationally, it's important that we do apply it safely and properly. One thing I would like to say, however, is those who have actually been tested for COVID-19 will know it's not always a very pleasant experience. It's a swab taken from the back of your throat and also from your nose. And for some older people, particularly those who are confused, that can be quite distressing. So yes, it tells you whether you're COVID positive or not on that day. It's not always the most pleasant of tests, so we need to take that balanced picture of older people in care homes. And what fundamentally is so critical to all of this is good, effective infection prevention and control within our care homes. That's why we've supplied PPE. It's why the Directors of Public Health and the Care Inspectorate are working closely with our care homes to make sure that we have enough staff in the care homes if they're needing additional staff, as well as any other advice they might need.
Thank you. Neil Puran from PA.
Thank you. Australia has today launched its contact tracing app, where people can find out if they've been in contact with people who've tested positive for coronavirus. I know work is ongoing with the UK's own contact tracing app. I was wondering when we could expect that to be introduced.
Can I just address that? I think there's a real danger when we're talking about test, trace and isolate that we think it's all about an app. That may well be part of it, but we need to build a capacity that is also based on people to do contact tracing as well. I intend that we will publish probably at the start of next week a paper looking at how test, trace and isolate actually fits into an overall approach to continuing to suppress the virus in the next phase. It's a really important part of the approach. It's also really important that people understand it's not some kind of magic wand solution. It still rests on continued social distancing to reduce the contacts people have with others. We will also set out then the progress of the work we're doing to build that capacity, that is testing capacity and contact tracing capacity, which we're seeking to build on that solid people foundation, although there will then be technology solutions that become a part of that, and a proximity app may well be a component of that. And then, of course, we need to start to make the public understand what the third element is and how that will work, which is isolate. Because a test, trace, isolate approach will lead to perhaps significant numbers in the population being advised to isolate, perhaps on multiple occasions over the period that we are pursuing such a strategy. So it's going to be an important part of the next phase, but that actually makes it all the more vital that we, just as we did with the paper last week talking about the principles that will guide our decision making going forward, that we start to really have that open conversation about what test, trace and isolate means, how it fits into an overall approach, and the fact that it will depend on its success, on all of us as members of the public doing what is required from a strategy like that. So we'll hopefully set out that detail early next week to allow people to develop that understanding of what that looks like in practice. Christine Lavelle from The Sun.
Yes, First Minister, are you aware of any cases in Scotland of this suspected virus-related syndrome in children that's been reported elsewhere? And has any notification or alert been sent to GPs in Scotland as has been done in England?
I'm going to, Gregor Smith covered some of this yesterday. Obviously, we wouldn't talk about any individual cases, but I'm going to hand over to Jason to say a bit more about this condition and how the work that's been done to try to understand that and make sure that we have the right information out there.
So we spoke last night as a group of 4 country senior clinicians about this and a number of other things late into the evening. This is a very, very rare condition that we do see occasionally in small children as a result of infection. So we're not completely shocked that a very small number of children have got this overreaction in an immunity sense. It's very small numbers of children normally, and again, it's very small numbers now. There are less than 20 children in this initial report, mainly from London, some of whom are COVID positive, some of whom appear to be COVID negative. It's not something that parents should worry about today. They should, of course, be aware of everything that's going on with their child, but the instructions and guidelines remain the same. If you're worried about your kid, whether it's their asthma or a new infection, you should contact your GP in hours, you should contact 111 out of hours, and just to reassure the public that we're monitoring exactly these type of things all the time. I've never known science to move as quickly as this science. Every day we get a multiple sheet update on all the papers published in the world on this disease. And this is just one such update, and we will keep a very close eye on it.
Thank you. Libby Brooks from The Guardian.
Sorry, First Minister. Just back to face coverings. Sorry, can you hear me? Yes. Back to face coverings. The guidance suggests that they're not appropriate for children under the age of 2. I just wondered what advice you would give to parents of younger children who might find covering their faces frightening.
Again, I'll hand over to Jason for the clinical elements of this. I think that is one of the reasons that we're not at this stage making that mandatory, because it may well be the case that for children, we're not recommending at all for children under 2, but for children a bit older than that, it may not be appropriate to do, and actually the disadvantages in terms of distress and upset to a child may outweigh the advantages, because particularly at the moment when the advice is to stay out of these kind of situations as much as possible, that may be the balanced judgment a parent will take. So it's one of the reasons why at this stage this is not mandatory. It is recommended, and particularly recommended for adults if they're shopping or on public transport.
I would only add what you've said, that it would be very unusual in the present circumstances for children to be in crowded areas. That literally shouldn't be happening. They should be at home or out with their own household. And we're suggesting that outside, this lends almost no protection that's worth it. The very specific places we're now suggesting it are in places where you cannot physically distance, and that would be public transport and perhaps crowded shops. I don't think children will be in those places. As we come out the other end, then the guidance will perhaps change and vary as it has already.
I should say, just as a final point on that, of course, again, just as I don't want the public to get an inflated idea of the protection that this will give, equally, this should not be seen as assigned to supermarkets or shops, that they shouldn't be ensuring safe public distancing, safe social distancing, because that obligation is there. So again, this is designed to be an added protection in limited circumstances. It is not in any way a suggestion or a licence to roll back on the rules that we're asking people to comply with. Vivian Aitken from the Daily Record.
Good afternoon. I'd like to ask a specific question about a postcode lottery which seems to exist among the shielded. As you're undoubtedly aware, the removal of the spleen leaves patients more vulnerable to the risk of infection, particularly sepsis and pneumonia. In England, these patients have shielded status and all the support that goes with it. But in Scotland, these vulnerable patients are not on the list, causing them heightened anxiety. Many are shielding themselves, but are doing so without the support of, shopping and medical deliveries, etc. With the actual those with the status who benefit from those. I know several of them have written directly to the Health Secretary, and others have tweeted yourself, First Minister, and Gregor Smith, although that's not, I know, the best way to get in touch with you. But the answers that they have got back from your officials is that all four nations have the same shielded criteria. However, this is clearly not the case. Will Scotland add these vulnerable patients to the list?
Well, I'm going to hand over to Jason for the obvious reason that the categories of people on the shielded list are not for me to decide. I am not a clinician, and my colleagues may sometimes feel the need to remind me of that, but I am not a clinician. So, and neither is the Health Secretary. So these are decisions that are based on the clinical advice that we get, and that's how the shielded list was developed. But I'll hand over to Jason, who'll say a little bit more about that process and how I assume that is kept under review.
It is. Let me first of all say about shielding, we don't do it lightly. Shielding is considerably constraining, and so we're not putting people on that list lightly, because it has real implications for how you live, even more implications than how the rest of us are living. The process is there is a 4-country meeting every Wednesday with clinical representatives from each of the 4 nations. One of our senior clinicians who works for us here and is an A&E doctor in his real life joins that meeting, and last Wednesday we decided collectively to add renal dialysis to the shielding lists. Now, in England, I understand just recently, if not in the last couple of days, they have taken a decision to add splenectomy care. That will be discussed tomorrow at the 4 nations conversation, and then each of the other 3 nations will make a decision about what and when to do exactly that.
Okay, so that is something people will be obviously kept up to date about. I should say more generally, anybody who is worried about a health condition who's not on the shielded list and who thinks they might be in the first instance, please talk to your own GP to get some advice from them. Gina Davidson from The Scotsman.
Thanks, First Minister. Just going back to Professor Hugh Pennington's evidence today to the Health Committee, he has said that COVID-19 is out of control in Scotland's care homes and that the R rate is around 10. Now, we've seen the deaths rise from a quarter to a third of all deaths, and who knows what it'll be at tomorrow. I just really want to ask how you propose to bring this number down, and is there any way that the NHS Louisa Jordan, which is sitting there in Glasgow, can be used to help care home residents who are infected?
Well, let me say a couple of things, and I'll remind you again, I've not seen Hugh Pennington's evidence. I have no idea what he would be basing that comment on about an R number of 10. When I stood here and published the document that we set out last week, I said that we think in the community the R number is now somewhere between 0.6 and 1. and recognise that we think it is likely to be higher in care homes, but where he's got the figure of 10 from, I don't know, because it's certainly not one that has been advised to me. Second point would be that we know that care homes, well, older people are more vulnerable to becoming ill and dying from this virus. And not just older people in care homes, older people generally. The figures we saw last week from NRS suggest that 9 out of 10 deaths are in the over 65 age group. But we know that this virus spreads more easily in what we would describe as institutional settings, so care homes, certainly hospitals as well. And the other contextual point I would make is that the emerging evidence from other countries is that the percentage of deaths from care homes is a high number of the overall number of deaths, and in some countries 50-60%. And I think we saw figures in England this morning suggesting these figures are a week behind the NRS figures in Scotland, but suggesting now that it's about a third of all deaths in England, and in care homes, that's the position we had last week, and I would expect that percentage to increase tomorrow, although we will have to wait and see. We are already taking a number of steps, and have been throughout, to try to prevent and control infection in care homes. Guidance has been issued from the early stages of this epidemic, advising care home providers of how they should be isolating and social distancing within care homes. As you've heard us, I assume, say previously in these updates, public health directors in local areas have clinical leadership now to make sure that the right actions are being taken in care homes. We're also been expanding testing. So we will continue to make sure that the appropriate steps are taken to give the protection and to keep infection out of care homes and to stop it spreading as much as we possibly can. I'm going to hand over to Fiona, who can say a little bit more about the arrangements that are currently in place.
And these arrangements are the effect. Well, first of all, I want to say how hard and relentless our social care workers and our nurses within care homes are working. They're working tirelessly 24/7, and the residents within these care homes are their family. So they are working tirelessly to care for them, to make sure that when they are not well, that they get the appropriate care and attention. So we do know that putting additional staff, additional infection prevention control measures where appropriate make a difference to that. And now that we're working and supporting the care home sector, who are predominantly the private providers, so we're working closely with them to give them the support that they need. I think it is important to say that the older people in care homes are in their home, and the Louisa Jordan was built for a different purpose. And clearly, if people in care homes are needing hospital care, they would be admitted to the local hospital. And thereafter, the Louisa Jordan would be used were we to need that for surge capacity. But I think it is important to stress, care homes in Scotland are the residents' homes. They are there, especially now when they have restricted visiting, with the social care staff and the nurses who have looked after them and cared for them sometimes for many years and need that support. So close early identification, early action, good infection prevention and control, and good overall care for the residents in our care homes is the approach that we're taking, and closely monitoring what that means. The testing will give us further information, further data on what that R number is.
Okay, thank you. Simon Johnson from the Telegraph.
Hi, First Minister. I listened to your answer earlier about the timing of this announcement on face coverings, citing new evidence, but we have known for many weeks now that there are asymptomatic people walking around inadvertently passing on this virus. What would you say to the accusation that taking a precautionary approach, this guidance should have been issued a long time ago? And also, I was wondering if you could tell me whether the advice on which this guidance is based, the scientific advice, is advice that's been seen by UK ministers.
I can't speak for UK ministers. I assume that they will have seen the same general advice that I have, but I think that's a question you would have to direct to them. Look, Simon, on all things here, and I'm not complaining about this, it's just the nature of these things. You will get people questioning you for taking decisions too early, and then you'll get people questioning you for taking decisions too late. We're trying to take decisions at the right time, based on the best evidence, with the best judgment applied to that. And as I said, one of the factors that was important in the decision I've made to publish this today is that I think the public are, certainly my anecdotal evidence is that the public are increasingly wearing these face masks, and I have a worry that people think it gives more protection than it actually does. So yes, this guidance is about saying we have advice that it does give some protection, but it is as much about saying to people, don't overestimate that, because it remains really important that you do all of the other things that we're asking you to do, because that will protect you and others much more than what we're now recommending around face masks. So we take these decisions, we're taking decisions literally on a daily basis right now, and we're trying to get those decisions as right as possible, bearing in mind that every single decision like this involves asking people to do things that are not natural for us in the way we live our lives. So great care has to be taken about these, and we'll continue to try to do that to the best of our ability. Paul Mallock from the Courier.
Good afternoon, First Minister. With your announcement today that you're recommending that people who are going into public spaces put on face masks, what sort of public information materials can we expect from the Scottish Government to make sure that the face coverings are effective and not just lost in the way that some of the glove advice has been? And also on top of that, what efforts the government going to make sure that members of the public don't go out and buy all of the medical face masks on top of that?
I think I missed a little bit in the middle of your question there, so apologies if that changes the context in which I'm about to answer it. But we put guidance on the website. NHS Inform website will be updated to reflect this. We are also looking at whether there's graphics that we can produce that give people a bit more information about physically how they attach a face mask of this nature. But we are talking about something pretty basic, you know, a scarf or a bandana or cloth or other textile. Remember, it needs to be something you're able to breathe through, but to attach that over your nose and your mouth. So it's not something that is highly technical here, which is why I think it's important to stress the limitations of it as well as the limited benefit. And in terms of the second part of your question, what we'll try to do to guard against that is stress very, very clearly that we are not talking about medical grade face masks here. We're not recommending that the general public wears those. This is about cloth face coverings, and certainly I can't speak for every country authoritatively, but certainly other countries that are issuing similar advice to the advice we're issuing today, it's cloth face coverings that they appear in the main to be recommending. So these are things that you will already have in the house, a scarf, a bandana, using another piece of cloth from a t-shirt, for example, to cover your face and mouth. We are not asking or recommending or suggesting that the public have to buy medical grade face masks, and I made that very clear earlier and make that clear again. David Ball from the Herald.
Thank you, First Minister. Matt Hancock has announced that some health treatments, including cancer care, are being restarted in England. Given the numbers of hospital and ICU admissions in Scotland have stabilised, can we expect to see some elective work and outpatient clinics restarted sooner than expected, including chemotherapy that was put on pause?
This is an issue that we're looking very closely and carefully at right now, and as part of our decision making on the next steps in dealing with this pandemic, that is very much a part of it. In fact, I think I mentioned it last week when we talked about the steps we need to take and the factors we need to consider from here on in. So it's something that is under consideration, and we'll set out more details on that when we've taken particular decisions. There's a number of factors we have to weigh up. Obviously, hospital and ICU capacity is one of them, but also making sure that we are certain that we are protecting patients who are perhaps coming back into hospitals for non-COVID procedures from being infected with the virus. So all of that is under active consideration right now. Rachel Watson from the Mail.
Can I just go back on face coverings as well? You say that the Scottish Government isn't going to enforce it at this point. Can places like shops and public transport or other forms of transport, would businesses be allowed to enforce this basically and not allow customers in, for example, if they're not wearing face masks?
No, that's not what we're asking or expecting people to do. That would not be appropriate, given that we're not making it mandatory at this stage. I'm trying to be as I've tried to be all along, as open about the balance of some of these decisions as I can be. There is some limited benefit from this, which is why we're saying to people to do it. But to make it mandatory, I think we'd be giving the impression that there is more benefit than there is. Now, the evidence and the advice may change as we go through different phases and as we know more about this virus, but that's the balance of the judgment we're taking right now. I am encouraging, recommending, suggesting, use whatever words you want, that people, when they are in, as I say, they shouldn't be in these kind of circumstances very often just now, but if you're in the circumstances of being in an enclosed space where there are other people around and you're not able to keep that distance, then think about, and I would say do use the cloth face covering, but it's not something that the police are going to stop you for, and it's not something that you should be enforced to do in that way at this stage. Adele Merson from the Evening Express.
Good afternoon, First Minister. A new report released today by Oil and Gas UK predicts up to 30,000 oil jobs could be lost in the next 12 to 18 months, mostly in the North Sea due to COVID-19 and a 20-year low in oil prices. Last week, you pledged to discuss with the UK government what extra support could be provided for the industry. Could you please tell me what discussions have taken place and what practical measures have been suggested?
These discussions are ongoing. Obviously, you're asking me particularly about oil and gas, which is a big concern given the impact there. But these discussions are ongoing across a range of different sectors and areas of the economy. We're also, as Scottish Government, talking to the oil and gas sector, Oil and Gas UK, to look at what we can do in Scotland to support the sector and also to support, crucially, to support the transition to the net zero economy that is an imperative that hasn't gone away despite dealing with coronavirus. So as we take decisions, as there are specifics around initiatives that we're able to take, we will set them out in the normal way, but these discussions continue at this stage. Tom Martin from the Daily Express.
Good afternoon and thank you, First Minister. Perhaps one for the National Clinical Director. Just going back to the issue of testing all over 70s admitted to hospital. I just wondered what do we currently know about hospital-acquired infections? Do we know of any cases? Do we know of any transmission rates as yet within that setting?
The science changes all the time. One of the things you need for nosocomial infection studies is you need more genetics. So you need to know that the actual infection patient A had went to patient B or staff member B. We don't yet have that level of science for this new virus. It's only 4 months old. Eventually, of course, we will, and scientists are working on precisely that. So when you hear us talk about MRSA, for instance, being transferred from one patient to another, it's because we know that specific genetic bug went from patient A to patient B. We don't yet have that technology or testing level available for this particular virus. We will have it, and then we will learn more about those, what we call nosocomial infections that spread. However, remember, the way to stop nosocomial infections is the same. Cohort patients who are positive or who have symptoms, do good infection and prevention control around those cases, and our hospitals are very, very able to do that.
And lastly, we have Kathleen Nutt from the National. Oh, no, sorry, I'm told Kathleen Nutt is not joining us. That then concludes the questions that we had today. Can I thank Fiona and Jason for joining me? Again, thank our signer, as always, for making sure these briefings are accessible, and thank you for joining us. If you are interested, and I would suggest that you do take a moment to look at the guidance that's on the Scottish Government website around face coverings, and that will hopefully answer questions you've got on that. And later today, Scottish Parliament is sitting today, so there will be a number of statements from ministers over the course of the afternoon, and I will answer questions from opposition leaders at First Minister's Questions at 4:15. And of course, we'll see you here tomorrow at the same time of 12:30. Thank you for joining us today.